So the really important thing here is that inflammation is inflammation no matter where it happens in the body. And a lot of times this inflammation that we experience in our body starts in the mouth. Everything starts in the mouth. And so what happens is we get these harmful bacteria in the mouth. In this case, it's going to be PG and FN. That bacteria is going to elicit a systemic inflammatory response. We're going to see an uptick in the collagenase enzyme MMP8, which is going to start to break down the gum tissue that surrounds our teeth. Those bacteria are going to enter our circulation, and the first place they're going to go is our heart. And so as we previously discussed, those bacteria are going to create an inflammatory response in the heart. We're going to see inflammation in the blood vessels of the heart. Again, the insides of those vessels will become sticky and more prone to plaques. They'll become more permeable and more likely to tear. But that inflammation then is going to be pumped out by the heart through the circulatory system. And the next place it's going to go, among other things, is to the reproductive system. And so we know that there are some specific bacteria that negatively impact our fertility. And this is in both men and women. Whenever we are talking about someone being infertile or having trouble with fertility, 50% is caused by the woman and 50% is caused by the man. So we know that bacteria in the mouth, FN and PG, are going to affect the arginine production for men. Arginine is a precursor to nitric oxide, which is needed for men to get erections. Those bacteria are also going to decrease the motility of sperm, so they're not going to be able to swim far enough to fertilize the egg. It's going to change the shape of the sperm head, and it's going to reduce the sperm count as well. So not good for men. On the women's side, what we know is this bacteria is going to cause systemic inflammation. Also, that inflammation is going to reduce a woman's ovulation capacity. And it's also going to make it not an ideal environment for an embryo to implant into the uterus with all the inflammation there. Now, if a woman does get pregnant and she has this bacteria in her system, or her partner is transferring that bacteria into her system, we know that the toxic byproducts of these bacteria will actually cause the rupture of the amniotic membranes, leading to preterm birth, which can lead to low birth weight, which we know is absolutely not good for babies. And unfortunately, the toxic byproducts could also cause stillbirths. So everything starts in the mouth. It'll go into the heart, enter the circulatory system, and can negatively affect fertility.